Today I'm going to present about a very common topic for the population, especially pediatric, is type 2 diabetes. So first of all, I'm going to introduce about my patient. His name is BV, date of birth January 12, 2008. He's a Hispanic male, came to the clinic with his mother for a follow-up of his elevated fasting plasma glucose that he did 10 days ago. So his chief complaint when he came to the office was, I had my lab done after my physical a week ago. I got a phone call from the clinic to come back to follow up because my blood sugar was high. HBI, BV is a 16-year-old Hispanic male. He's presented to the clinic with his mother for a follow-up appointment regarding his fasting blood glucose result is 148 and his HbA1c is 6.6. BV had his physical a week ago, but he didn't have his lab done because he was on vacation, so he had to come back this time. He reports that he was fasting for 10 hours before having the lab done, and he has family history of type 2 diabetes from his maternal grandfather. He denies any other symptoms related to diabetes complication, but he did mention that he increased his urination in the past few weeks. He has history of seasonal allergy and he's taking Zyrtec 10 mg once daily for that condition. Otherwise, no other significant hospitalization or surgical history. And family history, as I mentioned, maternal grandfather type 2 diabetes was diagnosed when he was 35 years old. Social history, he's the high school student. He doesn't smoke, he doesn't drink alcohol, he doesn't drink any alcohol drink. But for exercise, he report he not exercise regularly and not playing sport too much in school. He loves playing video game. So and for diet, for breakfast, he usually have typical diet with eggs, sausage, toast, with milk or orange juice at home. For lunch, he have whatever the school offers, or if he's at home, he gonna have anything fast like pizza, hamburger. For dinner, he gonna have a home cooked meals with protein, vegetable, pasta or rice. And he mentioned that he loves having snack during the day when studying or playing video games, especially chips, sodas. And he also mentioned that he's in school now and finals coming, so his stress level is pretty high. Review system, BV doesn't have any complaint, but he did mention regarding GU, he reports increased frequency of urination. He denies any burning, pain, or denies thirst sensation. Physical examination, his vital sign, everything normal size. However, his BMI is 26.6. It is the 93rd BMI percentile for adolescent. And his lab, his fasting plasma glucose is 148, HbA1c is 6.6%. Lipid panel is also irregular. Total cholesterol 220. LDL 188, HDL 49, and triglyceride is 178. His physical examination is unremarkable for any system that related to type 2 diabetes complication. Differential diagnosis can be, first of all, type 2 diabetes without complication. Second, metabolic syndrome because he has elevated BMI, elevated blood sugar, and HbA1c, and stress-induced hyperglycemia. As he mentioned, he having a lot of stress at school because he's having his final exam. And the final diagnosis regarding his symptom, his lab work, his BMI, his body size, so type 2 diabetes mellitus without complication will be the final diagnosis. The treatment plan, because right now he's diagnosed with type 2 diabetes, we need to use the pharmacological treatment. I'm going to use the metformin IA 500 milligram pill twice daily for him. Regarding his lipid, I'm not using any medication for now for the elevated cholesterol. However, I'm gonna stress the importance of lifestyle adjustment for non-pharmacological intervention. As I mentioned, I'm gonna prescribe a very specific exercise plan to make him do aerobic, a moderate exercise such as running, jogging every day for 30 to 45 minutes to improve his glycemic control. Also, I'm gonna educate the mom and him regarding diet change. They can adopt the Mediterranean diet style, which focuses on vegetable fruit consumption, and also they should monitor the calorie intake. Make sure that his teenager, his calorie intake should not exceed 2,400 kilocalories a day, and also he should eat in small portion during the day. Referral, currently he doesn't need any referral plan, but if his family and him have trouble with any diet change, we can refer him to the dietitian for a detailed plan. And for education, we need to stress the side effects of metformin, including GI distress. And also, again, we're gonna educate about the lifestyle change that can impact his health improvement. And he needs to be followed up after 3 months. We're gonna recheck his HbA1c, fasting blood glucose, and also lipid panel to see how he's doing with his medication as well as lifestyle modification. Thank you so much for listening. Have a great one.